Hi everyone. Today we have an interesting topic to discuss, that is gastrinoma. So what is gastrinoma? Gastrinoma is a neoplasm of gastrin secreting G cells. So it's a neoplasm of gastrin secreting G cells that is commonly found in small intestine, and the small intestine, the most common location is duodenum. So remember, duodenum. Sometimes it could be seen even in pancreas. So duodenum and pancreas are regarded as the most common sites for gastrinoma. Gastrinoma synthesizes excess of gastrin. Gastrin, as you all know, is the most potent secretor for hydrochloric acid from parietal cell. So there is hypergastrinemia, that is the result. Gastrinomas occur as sporadic solitary lesion in most of the individuals, whereas association with MAN1 or multiple endocrine neoplasia are also seen in few of the individuals. Morphology: single or multiple lesions. Grossly, they are form homogeneous and generally well circumscribed lesions. Microscopically, description is there is a nest of monotonous low-grade neuroendocrine cells. So as happens with all neuroendocrine cells, including carcinoid, here also we get monotonous low-grade neuroendocrine cells with typical salt and pepper nuclear chromatin pattern, that is the characteristic of all neuroendocrine tumors, is also seen over here. Also, there is pancreatic polypeptide cell hyperplasia that may be seen adjacent to the tumor. So here you can see the monotonous population of cells arranged in cords, trabeculae with granular chromatin pattern. And if we stain, it will be staining positive for gastrin, will be positive for here in this cells are known to secrete gastrin. Now, apart from the tumor, now there will be some changes in the gastric epithelium. These are the changes. You can see the parietal cell hyperplasia as well as so much of mucinous hyperplasia. Hyperplasia of parietal cell and mucinous next hyperplasia. This is due to the effect of gastrin on the gastric epithelium. So gastrin secreted by the G cells that stimulate these parietal cells and mucous neck cells of stomach to give this kind of hyperplasias. Coming to Zollinger-Ellison syndrome, this is also referred as alternatively Zollinger-Ellison syndrome, is the synonym for gastrinoma. This is the clinical entity that constitutes various clinical features like epigastric pain with weight loss. There is peptic ulceration due to excess of hydrochloric acid, and remember the ulcers are very commonly situated over the duodenum. Generally they are solitary, and sometimes they may be even malignant, sometimes even they may be multiple as well. Any ulcer in unusual site like duodenum, if your veneates or something is being mentioning that there is an ulceration beyond the duodenal bulb, even in duodenum location, then this is highly suspicious for Zollinger-Ellison syndrome. So solitary but multiple ulcers are also common, and even unusual sites are very commonly affected. That is the key feature of Zollinger-Ellison syndrome. There may be acid hypersecretion with diarrhea. There is a mild digestion of food because of acid interfering with pancreatic enzyme activity. Generally, sporadic tumors are solitary, aggressive. Aggressive here means there can be locally aggressive as well as they are malignant. They are known to metastasize as well, and they are commonly located in pancreas. Men1 cases are generally multicentric, less aggressive, and often arise in duodenal wall. Common age group is 20 to 50 year of age group. So common age group is 20 to 50. Sporadic and men1 cases are there. Sporadic cases are generally more aggressive, and men1 cases are generally less aggressive, and more of multicentricity is seen in men1 cases. Now coming to the management, and management includes the lab findings. The lab findings have this, we measure always the serum gastrin level. So basal acid output will be higher. Serum gastrin level, the basal serum gastrin level also will be higher. It will be more than 1000 picogram per ml. That is the characteristic feature. The treatment that is being conferred is The surgical removal of the tumor, that is the most important option. Apart from that, medical management includes the proton pump inhibitors that decreases the gastric acid and thereby gives symptomatic relief to the patient and prevents the onset of multiple ulceration. So that's all for this presentation, and hope you learned the important facts about the gastrinoma. That the gastrinoma is a G cell tumor located in duodenum and pancreas, could be sporadic or could be associated with multiple endocrine neoplasia, has potential malignant behavior, and the lab findings include serum gastrin level more than 1000 picogram per ml, and the treatment includes surgery and proton pump inhibitors. So that's all for this presentation, and see you all in the next video very soon. If you like the video, please press like, subscribe to the channel, hit the bell icon for regular notifications. Thank you all.